Diabetes causes your blood sugar levels to increase too much, while high blood pressure can lead to dangerous conditions like heart attacks and strokes. But although these two conditions are treated as if separate, there is increasing evidence they're actually closely intertwined, Dr. Mosley wrote in his Daily Mail article. Dr. Mosley looked at a few strategies on how to lower blood sugar levels as well as high blood pressure. This came as a new study published in The Lancet has found that lowering your blood pressure could help with type 2 diabetes prevention. The study looked at more than 145,000 people and discovered that only a 5 mm of mercury reduction in systolic blood pressure reduced the risk of diabetes by 11%. Blood pressure is measured in millimeters of mercury, short for mmHg. Pfizer booster shot, the unexpected side effect after third dose. Pfizer finding there are two different numbers, systolic pressure, higher number, and diastolic pressure, lower number. Dr. Mosley said, around half of British adults have hypertension, high blood pressure, while a third have raised blood sugar, and most don't know they have it because they haven't been tested. The good news is that if you treat one, there is a high chance you will also improve the other. For reasons we don't understand, lowering your blood pressure cuts your risk of type 2 diabetes. How to live longer, the cholesterol-lowering drink that significantly boosts longevity, Informer the longest you should go without showering during winter, expert issues warning, expert Pfizer booster shot, the unexpected side effect after third dose, Pfizer finding, Informer, the new study looked at medication and lifestyle changes, in particular, when it came to ways of lowering hypertension. Dr. Mosley then recommended various tricks for lowering both blood pressure and blood sugar levels, including singing. He said, I enjoy belting out songs while I am driving or in the shower, and fortunately, research shows that singing is a good way to reduce the stress hormone, cortisol, which in turn should reduce your blood pressure and blood sugar levels. The doctor explained that cortisol boosts your blood sugar levels by converting protein into glucose. With singing you might be able to see instant results, the doctor wrote. Dr. Mosley added, I remember, some years ago, seeing a middle-aged patient who was in the hospital for an operation, but her blood pressure was so high that the surgeons were anxious about operating. She began singing quietly to herself, and within 20 minutes her blood pressure had fallen enough for the operation to proceed. When you suffer from diabetes, you're at higher risk of having a heart attack or stroke. That's why it's important to keep your blood pressure levels in check, Diabetes UK reports. This is because high blood pressure puts an extra strain on your heart as well as blood vessels. As a diabetes patient, you should have your blood pressure measured at least once a year. The charity reports that for those with diabetes levels should be below 148/80ths of a millimeter of mercury, unless your GP said otherwise.